was quite overwhelmed, to be honest, when I received my PIN, because after the 3 years, all that hard work, I didn't expect that I would actually get to where I am, but here I am in my uniform and yeah, nearly 2 months in post, so really enjoying it.
Absolutely amazing. It's been a really tough course. It's actually my 3rd degree. So I've got a law degree, a master's in IT, and now the Bachelor of Nursing. And I can honestly say it's the hardest degree, so out of the 3 that I've done. So really, really chuffed. I've had lots of juggling to do with family and things like that. So it feels really amazing to actually qualify finally, which is wonderful.
So my mum is a nurse, and she has been now for 36 years, and I've always had her saying, do nursing, and I said no, I don't want to do nursing. I wanted to do event planning, and I went to college and I did health and social care, and I did a mind placement, and on that placement it really changed my mind, and really wanted to go into the mental health nursing, and that's what I did.
In 2018 I had a stage 4 cancer diagnosis myself. I had metastatic bowel cancer, it had spread to the liver. So I've had to go through lots of chemo radiotherapy, several surgeries, and the treatment from the nurses, doctors, all the healthcare staff completely changed my outlook on life and made me want to do something completely different with my life. I was lucky enough to now I'm lucky enough to train at the hospital where I was treated at. So I've actually worked alongside some of the healthcare professionals that actually looked after me whilst I was poorly. And that's been mind-blowing and just an amazing feeling to be able to give back to the hospital that I believe saved my life. So that was the inspiring moment, I think, when I got the all clear in January 2021. 5 days later I'd signed up to do my nursing degree. So I wasn't sure at that point whether the university would accept me because it was still so close to the treatment that I'd had, but they did, and I think that's one of the things that's really brilliant about the University of Wolverhampton, is that they do provide opportunities where maybe you wouldn't have got into another universities or something like that. But yeah, so here we are, and then I've gone from patient to nurse.
So I'm currently at the Redwood Centre, and it's a mental health hospital, working with the older adults, and that's something I'm very passionate about, and I wanted to do older adults from when I applied, because it's something I've always been very interested in, older adults. But yeah, so that's where I'm currently working. I'm really enjoying it. I have a supported team and learning every day. I think it's so rewarding. I think every day is a different day, and you learn and you work with so many different people, and it gives you the opportunity as like a 24-year-old. I now am a qualified nurse, which I didn't expect that would be, but I am, and I really do love it, and you help people, and it's a career for life. That's the thing for me, and I know that.
I think it's very challenging. It's very broad. There are lots of elements to nursing that you can follow. You can follow adult nursing, children's nursing, mental health nursing. So there's lots of different broad sort of avenues where you can go down. But in terms of the actual job, like I said, I've had other careers, and I can honestly say this is the most rewarding. I felt like some people are always looking for that thing in their life to sort of, I don't know, complete them or whatever. I know it sounds silly, but that's how I feel with nursing. In terms of fulfilment, nursing is a fantastic career with lots of opportunities for progression in the future. You've got the teamwork of fantastic colleagues around you, and the opportunity to, as I said before, really change someone's life at a time where they're really going to need you. If you're looking after an unwell patient and you have the opportunity to nurse them back to wellness, I can't think of anything better.